for this is not to say, okay, well, you have this, so you're excluded from sport. Not at all. The reason for this is like, okay, let's do a screen. So the big reason across the whole country that pre-participation physicals are done before people participate in sport is because there's a small percentage of the population that has cardiac conditions that could be really dangerous for sport, right? And so everyone should kind of get screened for that with the pediatrician or your family doctor, or your internal medicine doctor, listening to your heart, and they might do specific maneuvers that they'll have you in this position, that position to listen to your heart. And they'll ask you some questions too to make sure that it's safe. So that's a big reason that we do physical exams. Then the other reason too is like, okay, well, what are these other little things that we learn that might give us good information about how we make sure sport is as safe as possible for you? So again, having trouble with feeling your skin in certain areas means, okay, we need to really make sure that this sled for sled hockey fits, and if you grow, that we're growing it with you, or we're getting a different one and we're really keeping a close eye, right? And so here I will just go ahead and share that link that I had pulled up as well. So this is the form that you can bring with you to the doctor's office or share with your doctor. And I could share this information with you guys. So it's what's called the Pre-Participation Physical Exam, or PPE. And on this website, there's a couple of forms. So there's the history form, there's the medical eligibility form, and then there actually also is a form that's, in addition to those other forms, these other things to ask about for the doctor to kind of make sure that they go through with you, like we talked about, fracture history, and if you use a wheelchair or walker, if you have trouble feeling your skin, those types of things. So that's called the Athletes with a Disability form. Now, what I'd like to also point out is on this website, they separately have the forms for Special Olympics. And I'm actually proud to say that because of a conversation that I had with some folks at the American Academy of Pediatrics, this did go onto the website, because what we were finding was, and I had heard this from one of the head directors of Special Olympics Medical, was that a lot of athletes were bringing in the American Academy of Pediatric forms to Special Olympics to say, hey, these are my forms to say I qualify. And unfortunately, the Special Olympics forms are different. And so then they would have to go back to their doctor or have their doctor fill out a different form, because there are a bit more details on the Special Olympics medical form that really are geared towards athletes with intellectual developmental disabilities. So if that is one of the activities that you want to participate in, make sure that you're using the right form for it, and you can point that out to your doctor too. Okay, so coming back to our slides here. So, a moment. Next I wanted to just talk a little bit about when your doctor kind of goes through and talks to you about things, that they may have specific questions for you because you're spina bifida, right? And so the article that I wrote with some colleagues goes through lots of different medical conditions causing disability and what types of things the doctor should be thinking about. And so again, we've talked about a lot of these, and these are things that I'm sure you guys are very familiar with, because you may have a Chiari or a neurogenic bowel or bladder. And so these are some of the things that you're going to want to talk to your doctor about, because again, it's not going to prevent you necessarily from participating in sport. There may be something that your doctor finds that's like, okay, with your heart, or something that they want to get reevaluated. But the real purpose of talking about these things is so that you make sure that when you're participating in sport, that we're paying attention to those things and being like, okay, if you're going to be in a tournament, don't forget to cath, so that, and make sure that your coach knows that you have to cath at such and such time. And those are the types of things that, especially for the younger kids, might be really helpful and really good reminders. So this is all just kind of to help make sure sport is as smooth as possible and as healthy as possible. For really elite athletes, if you wind up participating in the Paralympics someday, it's important to know that some medications that you might take might actually be on a list of not allowed medications according to the organization. But that doesn't mean that you can't take your medicine anymore. And I would never recommend that anyone stop taking a medication just because they want to participate in sport. Not at all what I want for anybody. But what you do is you talk to your doctor and you say, okay, I need to take this medication for my health, but it's on the list. And so what your doctor writes is something called a therapeutic use exception. And so it says, this patient is on this medication. This patient is on Ritalin because they have ADHD, and it's not that they're using it to try to get an unfair advantage on sport. And so that's what we mean by a therapeutic use exemption. So if you're trying to go to an elite competitive sport and you're on medications, it's important to talk to your doctor to make sure that they look up that list and that they make sure if you have any medications that are on that list, that then they say, okay, well, this is an important medication for you to take. So I want to write that letter. Or they may say, actually, I don't know that you need this medication anymore. Let's try to wean it. And that's a conversation that you have to have with your doctor and not one that you should make on your own. So make sure that if you are thinking about these types of things, that you talk to your doctor first about it. So in terms of injury patterns, when we're talking about para and adaptive sports, so again, Paralympic style sports, most of the data and the information that we have is actually from research done from the Paralympics. So there's been some more recent studies that have been on that. There unfortunately haven't been a whole lot of studies on youth. And so that is an area that I hope to kind of study over the course of my career. But what we can best do now is just take the information from the more elite adult athletes and see how that applies to our population. So not surprisingly, athletes who use wheelchairs, wheelchair users have more injuries to their arms, and then athletes who walk or ambulate have more injuries to their legs. But the rates in terms of how much, like what percentage of people actually have injuries are fairly similar to sports in the general population. So strains and sprains and skin injuries are actually some of the most common things. So again, when I was talking about like sled hockey and making sure that the fit is right, that stuff's really important because skin blisters and wounds are some really serious things that really actually can make you miss a lot of sport time. So they're really important things for us to try to prevent. And so then in terms of the winter sports versus the summer sports, those winter sports are super fast down the slope oftentimes or on the ice. And so there's a lot more acute injuries. So like collisions, head injuries, fractures, or bruising. And with summer sports, there's a lot of the skin injuries because of sunburn or pressure or blisters from friction. And then with wheelchair track in particular, there were some nerves like carpal tunnel type nerve injuries, some median nerve mononucleopathy is what that's called. And then at the ulnar nerve mononeuropathy as well. So that's at the elbow. There's kind of a nerve there that sometimes can get a little irritated as well. So other things that we think about are overheating or getting too cold because some folks may have difficulty with controlling their temperature. And so that's an important thing for us to pay attention to. And so when we think about how do we try to prevent injuries, particularly like wheelchair users, how do we try to prevent those arm injuries that we're talking about? The way that you propel your wheelchair is actually pretty important. And so if you've never actually, for instance, gone to PT to see if you're propelling your wheelchair in a good way, or if you have shoulder pain or wrist pain, it might be a good thing to check in with a rehab doctor or a sports doctor to kind of look at the way that you're propelling your wheelchair, and also they may make adjustments to the wheelchair itself or may make recommendations to say, let's go to PT and like work on that pattern. Now, scapular exercises, so exercises to make you stronger so that it's easier for you to propel your wheelchair the right way. I tend to think that there's probably some benefit to that, but there hasn't been a lot of good research that has really said much one way or another about it quite yet. So I think there's more work to be done there. So what we do know is the Americans with Disability Act really is about trying to prevent discrimination against individuals with disability. And so if there's a public area that's supposed to be for, participation in recreation or sport, it should be accessible. So those are things that we all need to kind of continue to advocate for. We know that American Academy of Pediatrics is behind us and wants to help everyone promote the importance of physical activity and sports participation. And Paralympics is starting to get more media exposure. So we're hoping that over time, people are going to be learning more about this, understanding the importance of it, and hopefully that'll open doors for better access. But we know there's more advocacy to be done.